The birth of a child is a momentous occasion for any family. However, times have changed, and where natural birth was common practice before, birth by caesarean section is far more common. There's a lot of debate about the frequency and necessity of caesarean section births versus natural delivery. And in South Africa, the topic is quite heated among midwives, doctors, and parents.
I would say the reason why most women go for C-section is because of the pain.
I personally think if you can have a natural birth, it is better for mommy and for baby.
I would rather have a normal birth than the C-section.
I think a C-section is recommended more regularly by the doctors because it's more convenient.
C-section, you actually know when you're going to give birth and when to expect your baby.
Some of them don't actually want to go through the pain of giving normal birth or so.
And I think a lot of people think it's a safer option.
I think that natural birth is still the best because the healing process is better.
Once you finish with your delivery, your pain's over.
Helping me look at all the angles of this issue is fitness and wellness expert Lisa Raleigh. Joining us in studio also are medical practitioners Dr. Lerato Masimola and Dr. Darren Green. Welcome to Doctor's Orders, guys. So why is there such an increase in popularity of caesarean sections?
I think it's mainly convenience. That's just
Convenience.
my opinion.
That's just your personal opinion.
You know, there are bona fide medical reasons why somebody should have a caesarean birth.
Yes.
But I mean, we can't ignore the other side of, you know, we pick a date, we pick our child's birthday, it suits us, it suits the doctor, he doesn't have, or she doesn't have to wake up in the middle of the night to come and deliver my baby. There are various aspects to it, but I think we're looking at the first world scenario, you know, the US and UK. We are actually, in South Africa, still a developing country, have more caesarean section births compared to them. I mean, it's absurd.
Sure. And you can have elective surgery afterwards. You can have a tummy tuck, you can have liposuction, and you can come out of hospital looking like $1 million. You paid $1 million, but you look like $1 million. Do you know what I mean?
How did it happen? Because, I mean, before it was natural.
It's the media, you know, it's the pressure to always look perfect and amazing.
Also, I think the perception around C-sections, particularly now in modern society, is that people have become aware of autonomy, the right of the mother to choose. And that's become a big motivating factor. And it actually started in the early 2000s. Previously, the American Association of Obstetricians and Gynecologists wouldn't allow elective C-sections because of the medical risks of it being a full-on surgery with the complications that full-on surgeries can have.
Because people don't realize that surgery is actually, C is actually full-on surgery, and there are risks involved with any surgery.
You could have the risks from the anesthetic part and also from the surgical part.
Okay, so now what are the advantages and disadvantages of natural birth versus caesarean section, and what would you choose if you were in that position?
When I was in that position twice, I chose natural birth for you know, the birth of my children. And for me, it wasn't actually even a difficult decision to make. My mother has got 4 children, all natural births, and I've seen many women who come out of natural birth alive, you know, and the lower part of the anatomy still works.
Yes.
You know, with every single thing, there is something, you know, you can have complications. I can't sit here and say you will never have complications from having a natural birth.
Yes.
But a well-managed natural birth, you know, have the birth and everything goes back to normal. It goes back to also during the pregnancy, exercising and making sure that the muscles are nice and tight, everything can go back to normal.
Also, the recovery period
length of stay in hospital is much quicker. I mean, all of 24 hours, even a first-time mother can go. We don't keep them for 3 days in the private sector. Like, I mean, in the public sector. In the private sector, they stay for 3 days. But in the public sector, the minute you're well, you're walking about. There's no sign of hectic bleeding. Babies breastfeeding. Off you go. You know, you're more mobile sooner. So you don't stay in hospital and stand a chance of catching infections and things like that. Yes. But if you have a medical reason why you should have a caesarean section,
then
don't be dumb and say, I insist on a natural birth. Meanwhile, your pelvis is this big and your baby's like a watermelon.
There are indications.
There are indications. Yes. So obviously, you know, don't march into your gynae's office and say, I've heard that scissors are bad. Scissors are not bad. There is a place for caesarean section. And this is why back in the days, in the Julius Caesar times, somebody thought, we can't get the baby out, it's going to die, so therefore let's take it out through the tummy.
What are your thoughts, Advantages and disadvantages of a Caesar versus natural birth.
Alrighty, well, first of all, I think women should stop being too posh to push. I think it's ridiculous.
Yes.
Just through many years of helping pregnant women throughout their pregnancy to train, to exercise and keep their body intact, I've seen that women that have a natural birth compared to women that have Caesarean, they generally get their bodies back much quicker. The fact that you haven't got an incision in your lower abdominal muscles is great. I mean, it means that you can do all your core exercises and you can get your tummy right back to where it was before. Even if you had a six-pack, if you have a natural birth, you have a better chance of getting that tummy right back again. And the fact that when you have a natural birth, within a week or two, depending, you can actually go back to exercise. Whereas with the Caesarean, you have to go for your checkup at 6 weeks, and then you can only start exercising again. But just from my personal experience, I have seen women give natural birth, and then their bodies are amazing afterwards. Whereas Caesareans, it just doesn't seem to be the case. But yeah, definitely, I would go for natural birth with no drugs. Okay, don't quote me here.
No drugs.
But I would like
for
to.
the father.
No, he can have drugs, but I don't. I just would like to experience it. I think that's what nature intended.
But what are the financial implications and medico-legal implications for the increase in popularity of Caesars?
We all know that there's an imbalance between the public-funded healthcare and the private-funded healthcare.
Yeah.
And I mean, there's all this money that's in the private healthcare for a small amount of people being misused, basically. It's huge. I mean, I think this is why maybe even our government is moving towards the national health insurance to make sure that funds are evenly distributed. But also financially, imagine you have a Caesar elective and something goes wrong.
Yes.
Your hospital stay, your child, your newborn child also stays in the hospital with you if the mother's the one with the complications. There's more money from your side to fund for this. And I mean, sometimes the health funders, not sometimes, these days health funders put a limit to certain things, and they will have to look and see and sort of evaluate or audit, why are you there? And are you supposed to stay this long? I mean, you can't just say, I've got medical aid, therefore I've got carte blanche to do whatever I want. It doesn't work that way these days, They're very strict.
Darren, why do you think there's an increase in the popularity of Caesars?
I think the right to choose
That's the main thing.
It's become, people are more aware of it. I also think that people choose their specialist obstetricians and gynecologists based on whether that person actually enjoys or does elective caesarean section or not.
Yes.
There's no debate by everything we've discussed that the role and the necessity of the indications for an emergency C-section are all warranted, and that's understood. But one thing that I find that often is overlooked is what the effect of normal birth is versus a caesarean section on the baby. What happens to the baby's development emotionally? Does a newborn baby have the ability to feel? Well, of course they do.
I want to know, like if a baby is born by Caesar, does he have a tendency not to walk out of the front door but climb out through the window?
Stay away from the light.
Yes.
So the effect long-term on children in terms of an elective C-section versus natural birth, I mean, I'm more interested in seeing what new research and science is going to show on
So
that.
basic consensus is that natural birth is gold standard, but there are indications for a caesarean.
We need some celebrities to change the way women think. So all the superstars need to start saying, having natural birth is cool, is in. And then hopefully the rest of the world will follow suit. The minute that happens, you'll see a change.
And I think women need to empower themselves as well. The relationship between the doctor and the patient is two-way. You don't go to your guy and you sit in his seat and say, okay, tell me what you're going to do. Because then the guy will just pick whatever they want. You need to put down your concerns and your ideas and then meet a middle ground. I mean, if I had ideas about having a natural birth and something happened during labor, I wasn't going to say to hell with whatever the guy is saying, I'm putting my baby in jeopardy, I'm going to go the natural route. I would have never had said that. So more knowledge. And I don't talk about going on the internet and then searching about people who saying don't ever have natural birth, don't ever have a Caesar. Read reputable things that you can read.
It's like I know doctor, you studied for 6 years, but Google told me.
Yes, Dr. Google, my colleague, Dr. Google.
Self-diagnosis.
The bottom line is an informed patient is a happy patient.
Exactly.
And, that's in terms of medical accountability and that when the patient does develop any form of complication from an elective C-section, you can turn around and say to them, but it was your own choice. And when the family asks you, you say, I did inform them of all the risks, but it was, an autonomic choice.
If you look at the professional indemnities, gynecologists pay the highest in premiums.
Yes.
And I think these elective cesareans that just mushroomed out of nowhere play a role in that because of the associated complications that come with it. Yeah.
That's a lot of interesting points. Thank you, Lisa, Lerato, and Darren, for your thoughts and views on this matter. Thank you so much, guys.